Physics Part 414. Bone, however, causes a greater corresponding to these soft tissues. Well, when we talk about the X-ray images, bone, however, causes a greater attenuation. Attenuation reduces the intensity of a greater. Bone, however, causes a greater attenuation, reduces the intensity by a greater extent than the soft tissues, and therefore the photographic film will be lighter in color in areas corresponding to the positions of bones. What is produced on the film is a two-dimensional shadow of the bone and the surrounding tissues. The quality of the shadow image produced depends on its sharpness and contrast. Sharpness is related to the ease with which the edges of the structures can be determined. A shadow image where the bones and the other organs are clearly outlined is said to be a sharp image. Although an image may be sharp, it may still not be clearly visible because there is little difference in the degree of blackening between, say, the bone and the surrounding tissue. An X-ray image having a wide range of degrees of blackening is said to have good contrast. A sharp image requires a parallel X-ray beam. This can be achieved by reducing the area of the target node in the X-ray tube, limiting the size of the aperture through which the X-ray beam passes, and reducing the scattering of the emergent beam. The figure illustrates the effect of changing the area of the target node. The full shadow produces an area that is white on the development of the photographic film. Where there is no shadow, the image will be black. There is region of partial shadow and or grayness. The region is that of a partial shadow or grayness where the image gradually changes from white to black. If the image is to be sharp, then this area of grayness must be reduced as much as possible. The area of the target node should be kept to a minimum. A reduction in the gray area at the edge of the image can also be achieved by limiting the size of the aperture through which the X-ray beam passes. This is achieved by using overlapping metal sheets as shown in the figure. The aperture size may be varied by sliding the metal sheets over one another. The emerging parallel X-ray beam should then give rise to sharp image. However, as a result of interactions between photons and any substance through which the beam passes, this could even be air, some photons will be scattered. Scattered photon will result in loss of sharpness. The scattered photons may be absorbed in a metal grid placed in front of the photographic film. Good contrast is achieved when neighboring body organs and tissues absorb the X-ray photons to very different extents. This is usually the case for bone and muscle. This is, however, not the case where, for example, the stomach is to be investigated. The patient is then asked to swallow a solution of barium sulfate, a barium metal. The barium is a good absorber of X-ray photons. As a result, when the barium sulfate solution coats the inside of the stomach,